National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopath Dr. Jonathan Beatty here, health expert at Nationalnutrition.ca. Today, I want to let you know a little bit about autism or autism spectrum disorder and some of the things you can do to help manage the symptoms of this condition. So autism, or more appropriately what we call now autism spectrum disorder, it's characterized by delays in communication, social skills, or other motor delays. So it's basically delayed development. There's a variety of different ways it can be diagnosed depending on the symptoms. This is why we call it a spectrum disorder now. There are people that can be very high functioning on the spectrum, as well as people very low functioning on the spectrum, depending on the severity of their disease. I believe in a biomedical approach to the treatment and management of autism. Autism is characterized from a physiological standpoint with inflammation in the brain. Okay, when you have this inflammation in the brain, it's impairing normal cognitive development, which then leads to these delays. So if we can uncover what's actually creating this inflammation and help to manage that, we can improve a lot of the symptoms of autism. Now, some of the symptoms are actually not related primarily to the inflammation, but are related to what we call like comorbidities, often nutrient deficiencies that develop as a result of the delayed behaviors. Some of the things that we often see are very fussy eaters in children on the spectrum. And because of that, they may not intake adequate nutrients and start to develop and display other behaviors not often seen in all children on the spectrum. A classic example of this is when a child has a very strong oral fixation, often putting what we call organic materials, things like wood, cardboard, paper in their mouth. That can actually be a condition known as pica, which is an iron deficiency. And so there you may see, assume that the behavior is related to the autism diagnosis, when in actuality, it's a confounding factor of having an iron deficiency. And so actually correcting that iron deficiency can change and get rid of those, mouthing behaviors of constantly mouthing organic materials. I've seen a variety of different causes of autism. Again, as I said, oftentimes it's just this inflammation of the brain that occurs. One of the things we've been able to measure is there's an overactivation in the brain of a special type of cell related to the brain's unique immune system called a glial or a microglial cell. And these cells are involved in both the immune system of the brain, but also in the remodeling of neurons. And so when the microglial cells get overactivated, they don't remodel the brain's neuronal pathways appropriately. And this is what leads to the developmental delays, the communication and social delays. And so if we can do things to help balance out the microglial cells, reduce their activation, we can normalize their function and get them to start rebranching those neurons appropriately and help develop and treat the actual cognitive, social, and developmental delays. One of the first things I do, my gold standard, first things first, is reducing gluten and dairy in the diet. It is not effective for all children on the spectrum. That being said, I have actually seen a few cases where the children have lost their autism diagnosis upon the removal of gluten and dairy from the diet. The reason is in those particular cases, the allergy to gluten and dairy was what was triggering the overactivation of the glial cells. It can actually trigger a condition called leaky brain, where the blood-brain barrier gets disrupted, and then the brain gets irritated by chemicals in the body, and that's what leads to the inflammation and ultimately the symptoms of autism. So sometimes just going gluten and dairy free can be enough. It's not always enough, it's not always even effective. That being said, if you can, it's very much worth a try, because if it is that easy, you'd kick yourself for not trying it at least for a little while to see if you can have a positive impact on the person suffering from autism. Other things I look at are nutrient support. Children on the spectrum typically have higher rates of iron deficiency, magnesium deficiency, B6 deficiency, and B12 deficiency. There are multiple studies showing this. Typically it's because of a gut problem, a malabsorption of these nutrients. Sometimes though it's related to just poor diet. Oftentimes they get, children on the spectrum get very fixated. They love routine, they eat the same foods all the time, and that can develop nutrient deficiencies. So it's important to try and provide variety of foods, specifically fruits and vegetables in the diet, to try and ensure nutrient adequacy. And when that's a struggle, what we typically do is try and supplement it. You know, sometimes obviously children can't always swallow pills, so using powders and liquids can be more effective ways of getting magnesium, iron, B6 and B12 into the diet. Typically you can use a liquid B vitamin complex, a liquid iron and a liquid magnesium. And specifically for the iron and magnesium, an ionic or a solution form is usually best because they're easier for the body to absorb. And often, again, the reason the child's deficient in the first place is some level of impaired absorption. So by using a better absorbed version, you can reduce the likelihood of impaired absorption. So again, those nutrients, iron, magnesium, B6 and B12, that's one of my starting places when I'm treating children on the spectrum because of its importance for how the brain works and because these are often deficient nutrients. Additionally, I often recommend omega-3s, supplementing with an omega-3, specifically something high in DHA and EPA. That's because not only are these fats anti-inflammatory, they actually make up the brain. 22% of the weight of the brain is actually that one fat called DHA. So if you have a deficiency, as you can imagine, your brain is going to have trouble repairing itself and even trouble developing. And what we've seen is there are lower rates of ADHD and autism in children that have higher levels of omega-3 in their diet. So that might be one way that you can limit the risk of this. So as I said, you know, there's multiple causes behind it. I do highly recommend working with somebody specially trained in the treatment of autistic children. Ideally, in my personal opinion, from a biomedical approach, I do look at autism as a treatable condition. I've seen it, you know, very effectively treated in some children, which always gives me hope for the others. And you know, with more research in this area, with more development in this area, we can hopefully help more and more children who suffer from this condition, as it's something we're seeing more and more in today's society and affecting more and more of today's children. So I hope you've learned a little bit of something that you can use to help the autistic individuals in your life. And I hope that this helps motivate you towards, you know, improving all aspects of their health, you know, beyond just the behavioral therapies. You know, they're very, very important that you do the behavioral therapies to help improve their functionality, but that's not the be-all, end-all of autism treatment, and I do believe that it is a curable condition. So if you like this video, please check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below, and always remember, knowledge is health.